Welcome to iMove Physical Therapy's low back pain webinar. I'm hoping that this can serve as a nice break for you from the virus and the shutdown, and maybe provide some insight into your lower back pain or your loved one's lower back pain. My name is Bill Seiler, and I'm one of the physical therapists on staff here. And most of you probably know who iMove is, but for those of you who don't, we are a group that practices physical therapy, athletic performance, and wellness solutions. And we are actually celebrating our 15th year as a company, which is very exciting for us, considering we started off as just 2 PTs and have grown to 20, as well as other healthcare professionals, and have grown from 1 clinic to 7 clinics. And part of the reason for our success is our approach in individualizing care for each person who comes through the door. We have a whole body approach, looking at the area that's affected as well as other areas around it, and a whole person approach in that we're trying to teach the person's mind, body, and spirit, and making sure we're considering factors like your past experience, what you're going through currently, stress and diet, and things like that. So ultimately, I'm just really excited to be able to share this with you today. Webinar. A little bit more about myself here. Again, my name is Bill Seiler. I have my doctorate in physical therapy from Bradley University, and I'm from a small town in Illinois called Chillicothe. And I came to Michigan originally to play basketball at Hope College and get my bachelor's degree in exercise science. And that's also where I met my wife. And then we moved back to Illinois, to Peoria, Illinois, where I went to Bradley University for my doctorate. And we lived and worked there for about 4 or 5 years. And I worked in a sports med and orthopedic clinic. At that time, we found out we were expecting, and we wanted to be by her family when we had kids. And Marty offered me a job about the time we found that out. So the stars aligned for me. And I'm now the clinic director at the Grand Haven Aquatic Center. And that is my son, Mac, pictured there. He's 3.5 months old, and he and my wife are out of the house so I can do this presentation smoothly. And so what was it that got me interested in physical therapy and back pain specifically? When I was in 8th grade, I had a stress fracture in my back that actually went undiagnosed and led to chronic pain over 10 years. It was a frustrating process for me. I got passed around the medical system a little bit, was taking a lot of over-the-counter medication, and my pain never really went away. And it wasn't until I was in graduate school where I started to really understand physical therapy and what causes back pain that I was able to address this. And now it's been 10 years since I have had pain. So I'm passionate about this subject. And that experience, again, led me to my doctorate, led me to being certified in applied prevention and health promotion. And this led to my passion for empowering others to take their lives back. So what are you going to learn today? We're going to cover 4 topics. What is back pain? What is the scope of it? The 3 most common types of lower back pain, the 3 most common causes of lower back pain, and the 3 most effective treatments for lower back pain. So who is this talk for? This is for people who are in pain or are unsure on what are the next steps to take, whether you're in an acute situation where your pain has just started, or whether it's something you've been dealing with for a long time. It's for those of you looking to improve your quality of life, or maybe your self-confidence. If you're wanting to play with your kids or grandkids pain-free, get back to running, bend, lift, and twist without discomfort, this is for you. And ultimately, it's for those who don't want to depend on the healthcare system. You're tired of being reliant upon medication or injections or frequent visits because of your back pain. You want to experience that freedom from it. This is for you. This is not for people who are forced to be here, whether that's from an insurance company or whether that's from a spouse. It's not for people who want a quick fix either. Exercise is work, and it takes effort on your end. So it's not for those who are not interested in making changes in your life. And over on the right here, you'll see a readiness for change scale. And we use this often in healthcare, but it goes from pre-contemplation to maintenance and action. And if you're just thinking about back pain, you're thinking about your discomfort and whether or not you're ready to take steps, my goal from this presentation is get you to the point where you're taking action, where you have some tangible steps that you can take to start address this problem. Why is this something that we in healthcare are passionate about? Well, it's a big problem. It's an expensive problem. Pain affects more Americans than diabetes, heart disease, and cancer combined, and it costs $635 billion a year, which is more than the cost for cancer, heart disease, and diabetes. And back pain is at the top of that list. And I love this image here. It's of lemmings jumping off of a cliff. You'll see that there's 10% of these animals that have jumped off. Well, that represents our society in healthcare. 10% of the population is using the majority of healthcare dollars. And we want to shift our focus up towards those who are still on the cliff and haven't stepped off yet, because when you've stepped off the cliff, it's really too little too late for what we can do, unless you're the little guy in the parachute there. And so if we can catch your pain before it becomes more of a chronic issue and leads to more chronic problems, this can be a really beneficial thing in the long run for cost savings. And like I said earlier, back pain is really prevalent. 80 to 90% of the population will experience back pain at least once in their lifetime. The good news is that 95% will recover within a few months, especially with the right care, especially with physical therapy. And so if you're wondering if your back pain is appropriate for this presentation, we'll cover some items here. If your pain is reproducible, it's treatable. And when we say reproducible pain, it's either aggravated by an activity or emotion, such as twisting, working, sleeping, raking, shoveling, walking, standing, sitting, running, and bending. If we can't reproduce it, it's a little bit more questionable if it's in the right place. And there's something we look for in physical therapy called red flags. These are things where your pain is accompanied by fevers or chills, or you've had bowel or bladder changes with your discomfort. Maybe you've had progressive motor loss, some numbness and tingling in your groin region. If any of that's going on with you, you need to see your medical provider, your primary care physician, to figure out the source of that problem before beginning in conservative care. You are in the right place if your self-management has consisted of ignoring your pain or altering it. And we're going to spend some time here talking about that, because so many people ignore their pain or alter the pain, myself included. For years, I just ignored my back pain and accepted it as part of who I am. And ignoring it is the person who just says, I have my bad back. They're living with it day to day. It's present every day. You don't have to live with your pain like that. There are answers out there for you, and we'll get to that. So if you're ignoring your symptoms, or if you're ignoring your pain, you're in the right place. You're also in the right place if you've just been altering your pain. And there's really two ways people do this. The first is to mask their symptoms, whether that's with over-the-counter medication, injections, frequent visits, topical creams, opioids, which are a very hot topic in healthcare. If you've been altering your symptoms with that, you're not really changing your symptoms. Another way you can alter it is by altering your behavior. You avoid bending, lifting, and twisting. You don't run. You don't play with your grandkids because of your back. If you're ignoring your pain or altering your pain, you're in the right place. And our goal through the presentation, sorry about that, is to get you to the point where you're changing your pain. You're not dealing with it day to day, but you're actually creating lasting change and lasting benefit. So if you desire to treat the dysfunction instead of the symptoms, you're in the right place. So several of you have found the chat feature on Zoom here. I'd love for you to each put a quick sentence in on what brings you in. If it's pain with bending or pain with twisting, go ahead and take a moment to do that. It'll help me know the audience a little bit better here. I can't call on you because it's a webinar. So Derek wakes up with low back pain. Thanks for sharing, Derek. Chronic activity, right? So many of us have been in that situation where we've been dealing with this for a long time. This is great. And so go ahead and keep typing those in as I move forward. I'd love to get back to maybe looking at those later so I can better understand what each of you is going through. And at this time, while you guys are typing, I want to take a moment to highlight the bonus that you received as part of this, as part of being in this webinar, and that's our free virtual pain assessment. The reality of telehealth is that we've been doing this a lot longer than this virus has been around. It's been a part of the healthcare profession, and when we can get to know your individual stories, to hear what you've been going through and what's been bothering you, we can really make that lasting benefit for you. So take advantage of this. It's $60 in value. All you have to do is call our phone number listed here or visit our website and get set up, and you'll be scheduled for an appointment with one of our physical therapists on staff. They'll be able to hear what you've been going through. They'll be able to watch how you move and see what might be contributing to your low back pain. So let's get back to the spine. What is the spine designed to do? The spine has really two main functions. It's to protect the spinal cord, nerves, and organs, and it's to provide structural support and a foundation for movement. It's a very intricate structure that has a lot going on around it, so it can be difficult at times to figure out the source of the problem. The lumbar spine itself, which is your low back, has 40 degrees of flexion or forward bending, 30 degrees of extension, 20 degrees of side bending, and 5 degrees of rotation to each side, with anatomical variance being in there. And the big question that people have is, why does it hurt? And I want to spend just a couple minutes talking about this slide because it's more important to understand what's not hurting. Many of us have gone through imaging and seen things like disc degeneration, disc bulging, degenerative changes, and it scares us when we hear those words. But the reality is that tissue quality is not correlated with pain, and these MRIs can be misleading. The vast majority of people have these findings on imaging without discomfort. So this slide is showing that in 20 years old, in people without discomfort, 37% of people have disc degeneration, 30% of people have bulging discs. By 50 years old, it becomes the majority, and by 80 years old, it's the vast majority of people. So figuring out why things hurt can be a challenge in the low back, and we can't rely on that imaging necessarily. And I think it's best summed up in what is back pain, or how does it start, in three kind of broad categories here. The first is an acute event. Maybe you had a bending, lifting, twisting motion, you felt a pop in your back and a sudden onset of discomfort. That's one kind of trigger for this back pain, and there could be a tissue at fault there. The second is a wear and tear. Maybe you've adopted a movement pattern, or you've been doing a repetitive motion over time that's caused inflammation and irritation of the nerves around it. And the second is more so what these things can become, which is chronic pain, something called central sensitization, which is a heightened response of the nervous system to input or movement. It could be fear avoidance or altered movement patterns. All three of these things are why people have back pain and what they experience every day. And that leads me to my next point, which is the type of lower back pain. So the type of lower back pain, this is what we most frequently see walk in our doors in the clinic. And again, these are kind of broad categories meant to capture a lot of people, but they really do come up more often than not in the clinic. And the first is a herniated disc. The second is sacroiliac pain, or SI joint pain. And the third is stenosis, and we'll cover each of these. So the herniated disc. A disc is the structure between vertebrae in the spine, and herniations occur most commonly at the L4, L5 region. The disc itself is made up of an annulus fibrosus, which is this thick fibrous outer cover, and the nucleus pulposus, which is this inner crab meat. And this injury most often occurs in individuals who are 35 years of age or younger. Symptoms are worsened with forward bending, coughing, laughing, sneezing, bearing down, and it's usually accompanied by pain and occasionally numbness and tingling and weakness down the leg if a nerve is compressed. And all of you have probably heard someone say, hey, I herniated my disc 10 years ago, that's why my back hurts. Well, research has kind of given all of us a gut check and showing that herniated discs can heal just like a scratch on your arm. In fact, 85% of discs will heal within 6 months, especially with the right care, with physical therapy, and maybe only 50% with surgery. So again, they can heal. It can be something that can be addressed. It's not something you have to live with. The second type of pain is this SI joint pain. This is the type of pain that hurts when you sit down, hurts when you lay down, when you bend over. It's pelvic pain. It's very point specific, starting in your back, and can tend to radiate around the thigh or into the groin. This is common in all age groups. It's very common during and after pregnancy, and it tends to, again, be very point specific. The SI joint itself is where the sacrum meets the pelvis or your hip bone. And what happens is a certain movement or maybe a certain stress causes friction in that area, which leads to inflammation and irritation of the nerves around it, which is what causes your pain. And this slide here is showing the Sporton's fingers test. If you put your hand on your hip and your finger is pointing right to your discomfort, you likely have this SI joint pain presentation. And then the other slide is showing where it might refer to. And this is just highlighting how difficult it is, again, to treat the back. It refers symptoms into the groin and down the leg, and determining what's causing it or the type of discomfort can be challenging at times. So can the SI joint pain be healed just like the herniated disc? Yes, it can. When you reduce the friction, you reduce the inflammation, and things start to feel better, healing occurs. And the last type of pain is stenosis. This is what normally occurs in people over 50 years old. It's often associated with age-related changes. Pain often occurs with walking or standing, and is often relieved with sitting or leaning forward, such as on a grocery cart. And stenosis itself is just a narrowing of the joint space. That joint space narrows, and then certain movements will compress the nerve that travels through there, causing the irritation. 3 ways to make the hole narrow would be to lean back, to side bend to the same side, and to rotate to the opposite side. So just like SI joint pain and herniated disc, if we can reduce the amount of irritation to that nerve, it can heal and symptoms can subside. Probably the most important takeaway from all this, though, is that the type of pain is different than the cause of pain. And it goes back to the old head, shoulders, knees, and toes song. The whole body is connected. And if all we did was look at the low back and treat your type of pain, we may be missing out on what's causing all of this problem in the first place. And Marty Seitzema, one of our clinic owners, describes it as cleaning your leaves in the fall. And he says that we have this codependent, dysfunctional relationship with our neighbors. So if I go out into my yard in the fall and I clean up all my leaves, but my neighbors don't do anything about it, the slightest breeze can blow those leaves right back in, and I have a problem again the next day. Our neighbors to our back are the thoracic spine, the hip, the knee, and the foot. So when you come in and we look at your back, we have to look at the regions above and below it, because they could be causing the type of pain that you're feeling. And the 3 most common causes of lower back pain that we see in the clinic are the feet, the hips, and the thoracic spine. And ultimately, it comes down to this concept that if you don't have good mobility above and below the back is going to bear the brunt of that stress. Or if you don't have good stability above and below the back, it's going to bear the brunt of that stress. So we have to look at those regions above and below to see how they're contributing. So let's talk about the foot first. How does the foot, which is so far away from the back, affect back pain? Well, the reality is the foot is the first thing most often to make contact with the ground, and then it translates up the chain to our lower back. So unless you're walking around on your hands, your foot is always affecting what's going on in the rest of your body. So when the foot hits, it affects what happens at the knee, which affects what happens at the hip, and then affects the low back. I have a great example of this in a case that I treated recently in a runner with low back pain, and I do treat quite a few runners. This person had reoccurring ankle sprains, and their foot had gotten pretty stiff, but they came in with SI joint pain presentation. They had the pain with sitting and extending and so forth. And if they would have come in the door and I only would have treated their low back, I totally would have missed the cause of the problem. But when we looked at their feet, we found that their feet were really stiff. And so when they were running, it was causing a lack of motion at the hip, which was then making the back work harder. That's what led to that friction and the SI joint pain. So just by working on this person's foot, they saw a reduction in their back discomfort. The hips are probably the closest anatomical relationship you'll find to the low back. There's a lot of muscles that span both joints. And so when the hip doesn't work well, the back tends to really suffer from that. And I'll show you an example here in a second, but the hip joint itself is a really big joint with big muscles around it. It's meant to carry load and distribute force. And when we don't use it, if it doesn't have the mobility to be used or doesn't have the strength, again, the back is going to be suffering. So I'm going to show you 2 types of bending here. I'm going to stop sharing my screen a second. Make sure that you can see me by adjusting your view. And what you're going to see here is me bending with my back versus bending using my hips. So let's say my son Mac is in the room here and I want to bend down to pick him up. It is very easy for me just to round my back like so to pick him up from the floor. But what I'm doing is I'm just rounding through my thoracic spine and my lumbar spine, and I'm not using my hips at all. I can still reach low to grab him, but I'm not using my hips. And the difference between using your hips and your back is this. When I hinge at my hips first, my back hasn't even moved yet, and I'm already down to the same distance that I was. So now my spine isn't flexing, my thoracic spine hasn't even bent yet, and I don't have to stress my back quite as much just because my hips were involved. I'm gonna get back to my share screen here. So when your hips are involved, if you can teach your body to use your hips and distribute that force, your low back is really going to benefit. And that's a really common problem that we see in the clinic. The next is the thoracic spine. The thoracic spine has ribs that attach to it, and it tends to be stiff, but there's also times it can be hypermobile too. There's no exception. And just like the hips, it's a close anatomical relationship to the low back. So if it's not moving well, or if there's not good stability there, the low back is going to be stressed because of that. A great example is Tiger Woods here. Tiger Woods has had multiple back surgeries, and when you golf, you have a slight bend in your knees, slight bend in your hips, and they actually can tend to lock out the lumbar spine a little bit better. And a lot of the motion is intended to occur through the thoracic spine, specifically in rotation. But if someone doesn't have good rotation through their thoracic spine, you can envision how, if that's not going to move, the low back is going to try and compensate for that by moving more. And that repetitive stress over time might have been what led to his surgeries. So thoracic mobility and thoracic strength is just as important as hip strength when it comes to low back pain. So what does successful treatment look like? We talked about the type of pain and the cause of pain. So what do you need to do to go about addressing these problems if you fit this bill? The first is that you have to address the type of pain, because that's the injury that's occurred. You have to take care of that stressed area. The herniated disc is treated like a cut knuckle. You reduce the motion temporarily to allow that scar tissue to form, and then you restore motion afterwards. For SI joint pain, you have to figure out what's causing that compression between the pelvis and sacrum and reduce it to allow for the inflammation to go down, so then those nerves stop sending those pain signals. And for stenosis, you want to avoid closing that nerve down. You want to avoid that aggravating motion, increase mobility above and below it, so you can have more joint space there, so you can walk without pain and so you can stand without discomfort. Successful treatment is not only focused on the symptoms, though. You have to look at the root cause, that being the foot, the hip, the thoracic spine, and the chronic changes that occur with pain. You have to address mobility and stability above, at, and below the region that's affected. So just to bring it full circle, if your hips, your upper back are not moving properly, the low back only has so much to contribute. I love to think about this as a chain. If your hips are one portion of the chain and your thoracic spine is another portion, and they're not moving well, or they don't have good stability, what's going to happen to your low back? It's going to bear the brunt of that stress. And so we have to look at those regions. Successful treatment is individualized to every person who comes in the door. It's got to be a whole body and a global perspective, and include educational and empowering activities. It needs to be one-on-one, which is what iMove excels at. And it's got to include movement and exercise, because that is what empowers you. And it's got to help you understand your pain so you can retrain your system and improve your quality of life. The good news is that any exercise, or most any exercise, can reduce your risk of recurring low back pain by 25 to 40%. The challenge is that most people don't know where to start. They've tried to exercise, they've experienced discomfort. Physical therapists are movement professionals. We can help you find that starting point. And just getting moving again, you can see quite a large benefit just by exercising. And education alone isn't effective enough. So just listening to this presentation and maybe having a better understanding that, oh, maybe I have a herniated disc presentation, or an SI joint pain presentation, or stenosis, you really need to get back to exercising, to addressing those problems, to see that reduction in the discomfort. Why physical therapy as opposed to surgery or even injections? Physical therapists have an 85% success rate for low back pain, and surgery success is often lower. So when we think about the imaging example I showed earlier, and how imaging is not reliable in indicating the source of your problem, that's what makes surgery outcomes tough, is because it's hard to say, is this herniated disc, is their pain coming from this herniated disc, or is their back just being stressed because their hip mobility and thoracic mobility isn't good? The second is that you have to consider risk and reward and severity of your symptoms when choosing physical therapy versus something more invasive. The more invasive a procedure is, the higher the risk is, and there's nothing less invasive for this type of treatment than physical therapy. So the risk is lower and the outcomes are good. The good news is that in January 2015, Michigan became the 50th state to allow PT to see, or allow you to see a PT without seeing your doctor first, depending on the insurance. And by doing that, you not only will be able to address your pain, but you save money on the end, on average of $2,700. So it's not only effective, but it's cost effective to see your physical therapist. So bringing it back to this virtual lumbar assessment, when we talk about the pain, again, we talked about the types of pain, the causes of pain, and what successful treatment looks like. I'm sure most of you probably still have questions. Take advantage of this virtual lumbar assessment. We can do it from home, and we have a lot of tools available to us to be able to do this effectively. We've been practicing this way for a while. We can look at the way you move. We can hear your story and try and piece together the puzzle for the type of your pain and the cause of your pain. All you have to do is call that phone number or visit our website to do so. And I have a great team of physical therapists available who are wanting and willing to help all of you. And so at this time, I want to be able to field questions should anyone have them. Just type them into your chat box. If you don't want to hang out any longer, that's fine too. I appreciate all of you being here today to hear this, and hopefully this could provide some insight into what you may be experiencing with your back. Thanks a lot. So Tammy, I see your question. Do we need a doctor's note to get your services? It depends on the insurance. Some insurances will allow direct access. Some of them will require a doctor's referral. If you have questions about that, go ahead and call our office. They can help you navigate that, and we'll be able to provide insight in your situation. You can, and if not with me, we have a great staff of PTs with a whole realm of experience. Dan, I'm referring to your question for an assessment. Do we walk or talk or work with me? We have 20 PTs on staff, and so depending on maybe where you're at and availability, you'll be aligned with one of us. I see your question here. I don't think that would be a problem. A similar answer to Tammy. If you have questions about what that transfer might look like and the insurance approval, your best bet is to call our office and get connected with one of our staff, front desk staff members there. They work on this stuff every day, and we'll be able to help you with that. We technically are open right now, and there are some cases that we're seeing, and I think we're taking it by a case basis. Depending on the severity of the situation and what's going on. And I guess if you're having questions about that, Dan, your best bet might be to start with a phone call to the clinic and explain your situation. If you feel like a virtual assessment can help you answer some of your immediate questions, maybe start there. But if it's something more pressing, they'll be able to guide that process for you. Yes, thanks, Jeff. And correct me if I'm wrong on this. We are currently seeing some patients, depending on the case and the severity, if it's post-op or if someone's really having trouble making progress. And for some initial evals, we are seeing them. We plan to hopefully be reopened once the governor's restrictions lift, but we're trying to stay fluid in that process just because there's so many moving elements in this. But we do have clinicians currently working virtually via the telehealth options and in person. Sounds great. Thanks, Dan.